Post-op care of any FUE procedure, FUE/artist procedure is pretty much the same. Patients will always ask, well, with any operation, what are the complications? That's first. They're not the only complication, and this is a good complication, you're going to grow hair. That's not a complication, that's the hurrah moment, okay? The things that we consider complications or things that are kind of a nuisance that can happen, you can get swelling of the forehead. That usually occurs about day 3. So to prevent swelling, we've been toying around with a couple things. We used to use ice packs on the forehead, but now we found heating packs, just applying heat on the forehead for about 2 to 3 minutes, once an hour after the procedure while you're awake, with gentle massage of the forehead seems to prevent the swelling. So you want to do that for the first 4 days religiously, okay, to prevent any swelling that's in the forehead. Number 2, you always want to keep the grafts moist. When I was training in medical school, and even as a young boy, everybody would say, hey, you want everything to dry out and scab. You want scabs. Scab's a bad word. You do not want scabs. You want to prevent that scabbing process, because when the scab falls off or peels off, it takes off all the nutrients that are on the scalp, and the wound has to start again to heal. So what you want to do is always keep the wound moist. So we send you home with solutions that you spray on top of the grafted area, and you'll spray and just keep that area moist, again, while awake, to prevent scabbing. And usually that'll happen the first week. You just spray it liberally while you're awake, just to prevent scabbing. After a week, the hair up top will look like it did before you came to see me, so you won't have to do it anymore. Now, as far as the back where we punch out the areas for the grafts, you just want to keep this moist too, usually with a petroleum-based solution like Aquaphor. Once a day, you apply that on the back until that's fully healed, which usually is about 3 to 4 days. Now, as far as washing the hair, for the first 4 days, you don't want to get under the shower to let the shower head beat on the grafts, because it takes about 4 days for the blood supply to anchor in those grafts, so they're not going to go anywhere with just gentle agitation. So the first 4 days, take a big cup, mix shampoo and water, pour it on your hair, get the suds, get another cup, fill it up with water, and just rinse, until dry. And then just let that area air dry. You don't want to use a heater, you don't want to use gels, you don't want to use color. For the first week, that's what you want to do. So after about on day 5, you can get back in the shower, let the shower head hit it, massage the front and the back. You can almost forget you had a hair transplant. If you want to color your hair, we want you to wait at least 2 weeks after the procedure to color the hair or get a haircut. As far as physical activity, if you do cardio, about day 4, you can start back doing cardio. If you're lifting weights, wait a full week. And that's pretty much it. I mean, not very difficult post-op care at all. The other thing is that people don't have to come back and see me, like appointment schedules. Usually we see a lot of people from out of town, so we want to see everybody at least at the 8-month mark. And the 8-month mark seems to be the sweet spot for when the hair is really starting to grow and look good, where I'll feel good about it and the patient will feel good about it. A lot of patients always call me at 3 and 4 months, and they want to come in and see how they're doing. And to be quite honest, 3 to 4 months, it's not much to say. If a lot of hair is growing, I'm happy for you. We high fives, chest bumps. If the hair is not growing, I'm still happy for you. You know why? Because it is going to grow. It's just not grown yet, but it will grow. So 3-4 months is not really much to talk about. But once you want to wait to 8 months to about 10 months, then we have things to talk about. So we usually try to wait to 8 to 10 months to really reevaluate, the success of the procedure. So that's about it. We have a laser, and I found that red light laser is effective for healing, better healing, and stimulating the hair to grow. And patients who have a procedure are welcome to use our laser anytime they want to. So I see a lot of the patients we do surgery on almost every other day. You shouldn't use the laser every day, but every other day is fine. You can just use it as much as you want.